I welcome everyone to Self-Help Africa's Science for Development webinar series. And this is our first of a new series of webinars, each of which will showcase students that presented research projects in this year's 2023's BT Young Scientist exhibition. Each webinar will focus on an area that is relevant to Self-Help Africa's programs. Today's the focus is health. Self-Help Africa and United Purpose work with rural communities to help them improve the productivity of their farms and thus their livelihoods. Our mission is to empower rural communities to realize an Africa free of poverty. And on a continent where up to 75% of people rely on small-scale agriculture for their survival, it is only by tackling the challenges and inequalities faced by farming families that sustained social progress can be made across Africa. So that's the big picture that of our work. So let me introduce you to today's panel. We're featuring two student projects from this year's Young Scientist, one from Tipperary and one from Donegal. And we're also joined by a Self-Help Africa field scientist in Uganda. So first we have Ethan joining us from St. Columba's Comprehensive in Donegal with a study of a comparison study of the world's healthiest honey, being Manuka apparently from New Zealand, but being compared to Donegal heather honey. So hi Ethan. So joining Ethan from Tipperary, we have Rebecca Jordan and Sarah Ryan, and their social and behavioural science study titled Period Poverty, an investigation into the social and economic reasons for a stigma around menstruation and women. So hi to Sarah and Rebecca, and we'll come to you shortly to hear more of your thoughts. And then completing the panel, coming from Kampala to join us from in Uganda is Peace Nakito, and she is a Self-Help Africa country nutrition and gender advisor. You're very welcome, Peace. Can you hear me okay?
Thank you so much. Welcome, everyone.
Thank you for joining us. So Peace is a trained nutrition scientist with over 10 years experience working with multi-sectoral programs in both humanitarian and developmental contexts, with expertise in diverse areas, including maternal, infant, young child and adolescent nutritional health, but also looking at food security, gender equality and social inclusion. So you'll see that her expertise and her program work fit very well with the two projects featuring today. So you're all very welcome. And just as a quick round, we might go to each of the students with an introduction. So Ethan, if I go to you and ask you, can you give us a memory from being at the Young Scientist exhibition earlier this year? What stands out?
Well, apart from all the amazing exhibits that it's there, it's the friends you meet there. Like usually you go in with a bit of nerves, and you just think you'll just be focusing on your projects, but you get tons of time to go around and speak to tons of new people. Some might not have the same interests as you, some do, but it's just really interesting, and I would recommend it.
Brilliant. Brilliant, thanks for that. And I'm sure Sarah and Rebecca, you have similar memories, but also you were at the showcase in March. So what stands out to you from either event?
I think we really enjoyed both events. They were very different. You know, at BT you were surrounded by people your own age with kind of similar interests in changing and making the world a better place for us to grow up in. They were both amazing experiences that only really come once in a lifetime.
Great. But who knows? You're young yet. There's you don't know how many exhibitions and events you'll attend yet. So, but great that it's very positive. And to Peace now, if I can ask you just to have a bit of background, because we have young scientists here on the panel. we have students and teachers listening in, and part of this is to inspire future scientists working in development. So can I ask for a brief background to how did you end up doing what you do and becoming a nutrition scientist?
Thank you so much, Aaron, and welcome everyone to the webinar. My name again is Peace Nachito. I come from Uganda. Uganda is in East Africa. Just a brief background, I'm a trained food scientist, and I did my nutrition sciences from the Hebrew University of Jerusalem in Israel. And what really inspired me to become a nutrition scientist is I love challenges. I love intellectual challenges, and I love to be part of solution makers. So my growing up, I used to see, of course, a lot of issues coming from a developing country. So I purpose to be one of those people who can contribute to that change, the solutions, especially in the rural communities where, you know, Uganda, a lot of poverty and things to do with the malnutrition, poor food choices. So I purpose to be a scientist such that I contribute to the research, to the changes that we want to see in Africa and across the globe.
Wonderful, and we'll get to hear some of those programs shortly after going to our first project. So if we start with Ethan, you can hear me okay?
Oh, you are. Yeah,
Great stuff.
I'm perfect. So I'm Ethan. I've been a beekeeper for 4 years now, and I have an apiary of about 8 hives at the moment.
I didn't realize you were an actual beekeeper, so that's very impressive. And what Peace has to share will be very interesting to you because you are an expert, it sounds like, in bees, not just in looking at the honey. You were in the chemical and physical mathematical science category at BT, and the title was a comparative study of the characteristics and health promoting properties of Donegal's honeys versus Manuka honey, which I think is exclusive to New Zealand, yes?
It is indeed, yeah.
You went on with the title, The Comparison of the World's Healthiest Honey versus Donegal Heather Honey, and that you would investigate health properties such as vitamins, pathogens, minerals, and monosaccharides, if I'm saying that right. I'll just give Ethan a moment, and if he comes back, otherwise we'll come to you, Sarah and Becca, for your project, and then I'm sure Ethan will fix the link there. Okay, so sorry about that. So we'll come back to Ethan. So if I can ask, I'll just tell everyone, Rebecca and Sarah, your title, which was a social and behavioral science study titled Period Poverty, an investigation into social and economic reasons for a stigma surrounding menstruation and women. And you went on to describe your research. This project is based on accessibility in relation to feminine hygiene products, and that you also created an app to help reduce the stigma around periods. So tell us what you investigated and your results.
Our project kind of came out with the blue. We were on a FaceTime one night and we noticed a similarity. We both felt kind of judged or felt that we had to hide our periods or talking about menstruation in school and in the community. And we wanted to see, was it an issue for other people? So we kind of said it to a few of the girls, and as we started talking to people, we realized that it was a real issue in our surrounding area. So we got in contact, as the start of our research, we got in contact with a sociologist in UL, one of the colleges here. And we spoke to her about stigmas in society and how it changes society's views on different people and genders and things.
And we surveyed all the girls in our school to see, again, if it was an issue for them. And over 80% of them said when they first got their period, they were anxious and scared, and we wanted to try to combat this. That's why we made the app. From the survey, we also found there's a lack of education and these girls didn't have all the information available to them. So we included all this information in the app, like a Know Your Flow, a period tracker, and information on our project, just to get that information out and help the girls.
Kind of start an open conversation for people to not be scared of the topic and not try to hide it, because it is taught as a discrete subject for both boys and girls, and sometimes, you know, the lads are left in the dark and they don't know what to do, and it just kind of creates more and more of a stigma, and we're trying to reduce it. So.
Well, that's amazing work, although it's kind of upsetting to hear that it is the situation in Ireland today. So maybe two things come to mind. One is you said you surveyed your peers in your school, but it might be something that people wouldn't readily admit to. So how did you structure the survey is one question. And then I wonder also, did you look at when you were researching this as an issue, did you look beyond Ireland at the scale of the problem internationally?
The structure of our survey, we had multiple choice questions. So the girls kind of, all the answers were anonymous. So they just kind of went with what they felt suited them the most. And they weren't left to try to figure out and piece together what they thought. It was kind of there as agree, disagree, strongly agree.
In other countries, we were researching, and in Scotland in just 2022, they were, I think, one of the first countries to give all women the right to free period products, like all over Scotland. And we were looking at developing countries. When some women get their periods, they're kicked out of their house. They have to hide it, and you know. And we're hoping to start the open conversation to
kind of push the information out, because if a stigma is just a lack of information. If it's there and if it's provided, it'll take down the big wall of a scary subject, and it'll just become another normal topic.
Great to hear, and very well thought out way of gaining the data. So I see we have Ethan back, so that's great. So Ethan, we'll come to you shortly, but maybe if I can ask Peace to maybe respond to the girls' project, and then maybe showcase what you're doing in Uganda that is similar.
Brilliant. Actually, I liked the innovation. Speaking globally, there are over 500 million people that really, according to World Bank, that suffer from period poverty. So, and it's irrespective of whether the country is developing or whether the country is, first class. So I think the innovation alone, for me, it was quite an interesting thing. I think what I can already say for them is that the sky is the limit. Keep on, and as well encourage other girls and boys, of course, because we want to have an inclusive approach, to be aware of that, to be aware of the social cultural barriers around period poverty, to be aware that it requires, collective efforts. If we are to address the changes, of course, the teachers have to come on board. It's the same issue we have also in Uganda. We realize that about 28% of the girls don't report to school when they're in their periods. And of course, that proportion it triples when they're in their periods. Of course, some miss for other reasons, but it triples during the period time. And we already see that the government is already having a lot of, initiatives with, development partners. We have already innovative, lasting solutions to it. Of course, the issue is still there. I can't say it's limited now, but we see that the government is there. They are trying to include sex education, menstrual hygiene, curriculum within, the secondary level. And of course, we are seeing that with that, people are getting aware of the issue. It's no longer a women-only issue or a girls-only issue. It's becoming more societal. And we realize that it also has a lean on the Sustainable Development Goals. So, of course, the earlier all countries realize the need to get on board, collectively, using all these other multi-sectorial approach, the better we shall see it come to an end. Maybe I'll request at this point for the PowerPoint, I have some presentation just to throw in some light from Uganda, looking at what is happening. We have already organizations like Red Cross, Plan International, that have Keep a Girl in School initiatives. Of course, those are some of the innovative solutions that are trying to see that we have, girls keeping school. In Nigeria, in one of the Self-Help Africa programs, we have already a very strong menstrual hygiene project that is linked to WASH. I realize that without water access, of course, and sanitation, proper sanitation facilities that are designated for girls, we cannot talk about elimination of period poverty. So Rebecca and Sarah, you can see already some very good social behavior messages that you can already add on to your app. Maybe someone will be asking, what is period poverty? There are various definitions, but I try to put it together. It's the state where there's inadequate access to menstrual health and sanitation, products, as well as the stigma and shame that surrounds menstruation, preventing girls and women from participating in society, and of course, limiting their full potential gain. I already mentioned the statistics globally. I already also mentioned about the Uganda statistics. We see over 28% will miss school when they're in their period days. So the innovative solutions are there. Time and again, we try to see that WASH, the water access, sanitation, and hygiene, is embedded within all menstrual hygiene facilities and programs. Because if you're talking about period poverty, we have to address the issue of availability of water, availability of gender-sensitive sanitation facilities, such that, of course, the boys give that due respect to the girls when they're in their, messes and all. So some of the mitigation measures I already mentioned, the government has to have a really buy into that, knowing that collectively, all countries contribute to the SDGs. So we are seeing already 93% of schools in Uganda have received special education sessions on menstrual health, hygiene, and management as of 2019. Of course, the statistics keep going up because people have tried to already embrace that it's relevant, and we need to see that we address it in real time. The issue of knowledge gap, again, as Sarah and Rebecca were talking about the app, we need to know that people need to be aware of what you've done. So knowledge enhancement is very key because those innovations add on to what already has been done, but people have to be aware of this issue. So boys and girls, as I mentioned, as we break the barriers and stigmas, need to come on board at an early stage. Adolescent stage, we even encourage parents as much as possible to talk about that, to talk about the issue of cleanliness, personal hygiene and all that when it comes to menstrual health, hygiene. Again, the issue of girl-friendly designs, I'll emphasize it again for toilets and latrines, wherever that applies, whether marketplaces, we encourage it should be one of the key mitigation measures. Again, training the teachers, please, Rebecca, and again, Sarah. I don't know how far your app has gone, but it would be a very good thing to layer it onto what is existing, maybe in Ireland, and also see that it's adapted across for all the various, cadres, the students, the teachers get to know about it, such that there is collective efforts towards, eradication. Again, at country level, we've seen efforts to improve access to affordable and hygiene solutions. We see that there's efforts in some countries where they no longer put tax on, the pads, the sanitary pads. And also we are seeing local solutions where girls, for example, I mentioned already Nigeria, where Self-Help Africa has a very good and strong, with United Purpose, a strong WASH component. We see that girls, it's better to train them in the, tailoring of those local sanitary pads. And of course, when we are training them in that, we also emphasize the bit of safety, health safety, as well as, cleanliness and all that, such that, again, we don't have negative consequences from the intervention as much as possible. Again, I want to emphasize the bit of addressing social cultural restrictions. We have in Uganda some local communities where the toilets cannot be shared once a woman is in their menstrual periods. So those are some of the local things that really need to, address through strong behavioral change mechanisms, through, inclusive interventions, as much as possible. Thank you. Thank you so much.
That's great insight, although, again, quite shocking, really, that the situation that women and girls are facing, both at home, even in school, and then, like you mentioned, out trying to work and visiting things like the marketplace and things like that, all the obstacles and limitations. So maybe before we go to Ethan, we'll go back to Sarah and Rebecca quickly with this innovation, really, which is a big part of our work, looking for solutions and trying out things. So obviously the internet and the use of mobile phones and even smart devices is spreading and increasing across all regions and levels of society. So the fact that you looked into developing an app and you used a platform that I think is called Thunkable, which is a new one on me, which wouldn't be hard, but it's a new one. So I just wondered about that. How was your experience of creating an app, and how successful was it?
So I had fun making that. I thought, especially on Thunkable, it's really easy to use, and then when we made the app, I think anyway, the app's fairly easy to navigate and everything's labeled.
We have worked together before on projects like coding and making different apps. So this was really nothing new to us. We had worked on it. It was just getting all our information into the app in a way that someone that has never came across the project before was able to pick up and see what was there for them and what information was there to be given to them.
And we used Canva to design the screens of the app to make sure it looked nice as well.
We all like an app that looks nice.
For sure. So the programs you used was Thunkable and Canva to design the look of it. So that they might be useful tips for similar projects that maybe are using apps, which more and more are. And I know there are programs that Self Help Africa uses in many different ways, using mobile phones, using smart devices to share information, to empower people with information in health and in economic ways as well. So there's lots of innovation there. Let's go over to Ethan and hear about his project. He compared the properties of the highly promoted Manuka honey from New Zealand with his local honey. And we just heard there also that he is actually a beekeeper, so he knows what he's talking about. So Ethan, hopefully you can hear us and all is good again there in Donegal, and give us a overview of what you did and what you discovered about the health properties of these two honeys.
Well, honey in general it's a superfood. It's been used since way back in time. Here in Ireland, it was used in Breton time to make something I've never tried, but I'm something called mead. Honey itself is good for is antibacterial, antimicrobial, antiviral, antifungal, anti-inflammatory, and antioxidant properties. So it is really good for you, and it never goes off. It's the interesting thing about honey. When they opened the pyramids of Egypt, they found honey in jars, still edible till to this day. Now I wouldn't want to try that, but it just shows off how it doesn't go off. The reason I did it was since my brother, when he was younger, had asthma, and so he went on antibiotics. One thing that happened was he got an immunity to those, and through that we had to find a natural solution. And interesting enough, 3 years later, he recently just won a European silver medal, and he is he doesn't have that many asthmatic tendencies anymore. So what I'm trying to say is honey is really good if you're sick, if you have allergies, or if you have anything called an upper respiratory disease. Once you consume honey, it mixes with the enzymes in your mouth, and it produces it improves the production of saliva, which then coats your mouth, which helps with coughs if you have that. I know it was a savior for me when COVID hit. It gives you a bit more energy. It is 180 substances and 28 sugars, but what these sugars are, they're like fruit, and they are they're good for us. So some people with diabetes came to me during the BT competition wondering if they could have honey. The hazard with some honeys is the pasteurization of them, or the blending of them. A recent article I found was that over almost half of honey that's imported into Europe, especially, is watered down. What they're trying to do is they're trying to get more out of what they produce. Just creates a lot more hazards for the consumer itself. Really, they do it to keep up with the honey market. Me as a beekeeper, I'm a bit competitive myself, and once I kept seeing how good Manuka was, I thought from my own experiences that I'd like to try my honey against this Manuka, and so that's what my project's about. I disliked how Ireland imported 4,086 tons of its honey when it only produces 205, which I dislike the air miles it would have on it has. It ruins all the good work the bees are doing by putting increasing people's carbon footprint, when I know we are well capable of producing tons more honey. An interesting with a beehive is it can be anywhere. It can be in a rural or an urban area. There's beehives on top of Dundrum Shopping Centre in Dublin, and well, I have beehives out here in the hills of Donegal. The thing with Manuka is it has a thing called the unique Manuka factor, where it is the turnover of a compound called dihydroxytone, which is where it gets its MGO, or methylglaxyl, which you might see in the label. And what this does is it tells you how strong the Manuka honey is. It comes from New Zealand, and it comes from a bush that can only really grow in the climate in that oceanic environment. From what I found was there's not really a honey best for everyone, but there is a honey best for you. That being the local honey in your local environment. The flowers are exposed to the same pollutants in the air as you are, and so when the bees come across these flowers, they can actually get the plant's tolerance to a lot of these pollutants in the air, and it transpires into the honey itself. Yeah, that's why you hear a lot of people saying that local honey is good for you.
Very good. So did you did this actual scientific comparison of the two varieties, and what were your results? Was one dramatically better than the other, really, as it was claimed?
From my tests, which was an antimicrobial, antibacterial, and antioxidant tests, I found that it was really only the antioxidant test where Manuka had a higher percentage, but it only had a percentage of 0.6% better. So what I'm trying to say is that in my test, it didn't blow my heather honey out of the water per se.
You don't use of Manuka honey are unfounded, is it? But it's just it has so much marketing that people choose it as a superfood. It's even better than honey, but that's not really the case.
No. See, Manuka honey, it's really well marketed around the world, and it's like a rumor that spreads like a virus, where everyone thinks, oh geez, I must get my hands on some Manuka, because, well, so such and such said it was a superfood, as you say. That's not the case.
It's really interesting, and you have covered so much in what you've just shared with us there, that I know Peace can now speak on, because you've spoken not only on the issue of carbon footprints or your food miles, which is a concern for us in general with sustainability and climate resilience, but you also mentioned the importance of local food, a local product, and how valuable it can be, and how the health properties of the honey, but also the possible dangers there are to people if it's not a good product, and the fact that it can be blended and watered down, which has issues. So maybe we'll go over to Peace, and you can comment on what Ethan has said, and speak of your experience of the value economically and health-wise of honey and keeping bees.
Very good presentation there. Good to know that you're a farmer, Ethan. So just to pick it up from there, honey also presents as a functional food. It's when you compare its glycemic index, it's better compared to the table sugar. So time and again, we recommend it. Aside the medicinal properties, it also presents as a functional food like yogurt or any other of those kind of foods. Again, just to caution that as we do a lot of processing, there is a potential adulteration along the value chain of honey. So even when we are advocating for the medicinal and antibiotic properties of honey, we need to be aware that food safety is critical. There are potential cases of Clostridium botulinum, that bacteria that can easily get into the honey. So that is why also globally they don't recommend it as raw honey to be given to children below 12 months. So the food handling bit is very critical. And maybe just to add on to the other benefits of honey, it has broader, societal benefits, both at community level and as well as the household. And in Uganda, we have over 1.2 million people that are involved in apiculture, that is the honey production. And I think across Africa, Ethiopia presents as the highest producer of honey, followed by Zambia, which is I think the highest exporter. Yeah. So for Uganda, our potential is high because of our diverse floral, cultures and all that, the floras that we have, the species and all. But again, the current production potential is just over 500,000 metric tons per year. We've not yet reached our, we would produce more than that, but we have, incurring challenges to the honey production. Some of those really, they may also be present where maybe the honey beekeepers are in Ireland. Maybe Ethan, you tell us since you're a honey farmer. But one of them is the use of agrochemicals. Time and again, pesticide residues and all have been found in Ugandan honey. Not so good to mention, but it's the fact. So as Self-Help Africa, we try to promote organic climate smart agriculture. And we have also issues around access to durable equipment. Most of it is expensive for the smallholder farmer. So what we try to do is to try to link them maybe to financial products, to microfinance support centers that probably can give them maybe honey extractors or honey protective gears and things to do with that. And most times the farmers face low product prices, mainly because of the middlemen. Looking at where, for example, in Uganda, where most of the honey is coming from, it's from the local, very rural centers, most of it. So by the time it reaches to the marketplaces, the real farmer doesn't get the really desired price that they would want. Then we continue to see traditional production systems. A place in Karamoja where one of our projects is, the Market Rural Enterprise for Honey is, we see people still having beehives up in trees and forests. So those are some of the traditional production systems that may really sometimes inhibit the productivity and the gains from the honey value chain. We also continue to see inadequate capacity skills for some farmers. So Self-Help Africa, among other actors in the honey value chain, continue to see that we empower both the men and women to take their full potential within the honey value chain as much as possible, including issues to do with post-harvest handling and market access. Traditionally, honey has been meant to be a male-dominated sector, but time and again we try to see that it comes in a way like it's gender sensitive. We try to ensure that there are gender transformative approaches to the use of the money that comes from the sales of the honey, because most times, as we know, the men take decisions in homes. So we try and see that the women take part. You can see someone there counting money. Those are some of the the village saving loans, the associations that exist in Uganda. You can see a happy family there. Of course, when the gains come from the sales, the family is able to maximize for food security, to meet health needs, to early health seeking for the children, diversity of the foods. They're able to eat good food, balanced meals, and things to do with that. So we continue to see honey presenting as an income source for smallholder farmers, but not only in the rural setting, also in the urban areas, say like Kampala, where the capital city is. So we see like there are various honey products. We have the jellies, we have the propolis, we have the beeswax. Yeah, those are continuing to come through. And I already mentioned honey as functional food. Low glycemic index means it's a rating system given to foods that have carbohydrates. So for honey, it doesn't shoot up the blood glucose levels very high compared to foods like white rice and soft drinks and all that. I think Ethan, you brought it very well. The medicinal properties, well done. You explained that very well. And given the global antibiotic resistance all over, I think honey continues to present as one of the promising, health products that is nutrition-based. Again, maybe just to mention, when the money comes through, like I mentioned earlier, sometimes it may not be used for the right purpose. So time and again, we advocate for the correct use of the household income as much as possible when it comes through for the smallholder farmers that we support. Yes, thank you so much. Thank you.
Thank you for that piece. There's a lot of background and information there to show the importance of honey as a product, an income resource, as well as the health properties for it. And then, as Ethan has said, that if we promote local over supposedly better brands, that is also very important, be it Kampala or Donegal. One briefly, maybe, because Ethan, because you actually keep the bees, and you both mentioned sort of organic. Can you explain on that? How can you get or an organic certification for honey?
Yeah, so it's a really good marketing ploy. Tons of companies use, but the way you decipher that is a bee will only travel 5 kilometers away from the hive. So what we do is we get a map and a compass, and you get 5 kilometers, and you draw a circle, the flora that it's most prominent in that area, and that's how we declare what the honey is. Now you would be right in saying that it might be mixed in with maybe a little bit of dandelion, the way people do heather honey, and apple blossom is another one, by the majority of flora in that area.
Great. And I understand also that bees, bees are clever, why they won't fly, that might be the limit of their range, but they won't fly too far beyond a good source. If they have plenty to be collecting from nearby, be it apple blossoms or heather, then you can be sure on the whole what they are collecting from. So great, brilliant. So it does sound, Ethan, with all your background and knowledge and skills, that your bee interests might be affording you some exotic journeys if you're into it. It sounds like places like Ethiopia, Zambia, and Uganda would be very interesting places for you to visit. I'm sure Peace would be very happy to hear from you if you have any questions after this. So we're running short on time. So maybe if I could go back to Sarah and Rebecca quickly and just say, I wonder if you have any words of wisdom, any advice for students and teachers that maybe are about to consider future research projects?
If you're on the fence about doing it or not, I'd say definitely do it, because even at the start we were a bit like, oh, do we want to do it? But then you see the impact you make.
But I think the scariest part of it all is starting in your own community and in your own school for us, because you know everyone and you're with your peers, and to come out and say this big kind of problematic, some people would say, topic, to just shove it out there in the open, especially in a mixed school, it can be very, very scary. Yeah. But the benefit it had on the girls, it made it all really, really good and such a positive experience, because for us, we saw it as, what if this all goes wrong and we're just known as the girls that tried this? But no, look, we made it here, and we're very proud of ourselves for that and starting the open conversation.
Very well put, yeah. Be courageous and try the take the hard path if that's what interests you and attracts you, and challenge the status quo. Be disruptors is a term that I've been coming across recently. So fair play to you, because that's how change happens. Ethan, do you have a pearl of wisdom for those that are maybe worried about starting a research project?
The best advice I can do is go and do it. The start is always the hardest part, and especially when it comes to a young scientist project, my best advice is, if you're going to do it right. So don't be afraid to reach out to big corporations or anything, because they'll be more than happy to come back to you. I know I was a bit nervous messaging my local college, but they were very helpful in the research, allowing me to research in their labs. So if you want to do it right.
Maybe before we finish, Peace, I give you the last few words to respond to what the students have just said.
Thank you so much for the tremendous work on the two projects, Ethan, Sarah, and Rebecca. Again, I can say that keep the determination going, and yeah, you're yet to rise higher and higher. And maybe I can use this opportunity just to add on to what Ethan mentioned. When it comes to honey adulteration, we need to be cautious that it has a lining to the obesity, the rising obesity, because many people put in, these sweeteners and fructose syrups and things like that. So people need to be aware that adulteration is beyond what we see. It has detrimental effects, and it's a public health issue, obesity. Very true. So do your research and read your labels is good advice as well on all whatever you're buying, and then also support local, I think, is also a good slogan to end on. So thanks for everyone, to our panel and to everyone that joined us, and there will be another webinar
later in the month. I think it's going to be focused on agriculture, and again we'll feature two projects and a Self-Help Africa scientist. So hopefully we will see you all again. So for now, bye to everyone who's listening in, and thank you to Ethan, to Peace, and to Sarah and Rebecca for your contributions.